Gait aids can be an important aspect when recovering from different injuries or surgeries. Today, I'd like to talk a little bit about some of the things to look for when we're using a gait aid. Before I continue, hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. My purpose and passion is helping those individuals who are struggling with their day-to-day activities regain their functional goals that they desire to achieve. So getting back to this idea about proper gait aids. So there's different gait aids that an individual might have depending on their ability to weight bear, the type of injury or surgery that they've had, and also just their general strength. So, for example, somebody might use a walker or a wheeled walker, post total hip, post total knee, then perhaps transition to a cane. And then from there, there's different walking patterns that an individual might use, depending again on their functional abilities and any sort of specific restrictions that they might have either from their surgeon or or depending on a specific diagnosis. Another gait aid could be simply using crutches, for example, if somebody is fully non-weight bearing. And so today I wanted to talk a few things about a few different aspects in terms of measurements and ways to use the gait aid. So number one, with both your cane as well as the walker, the typical measurement is going to be around your wrist level. So again, if we're thinking about where, for a cane, for example, where the handle is or where the handles are for your walker, you're going to want to have them around that wrist level. So again, this is going to enable you to have the correct sort of posture when we're using this and not putting as much force down through our shoulders. So for example, if your walker or if your cane is too low, right, we might end up being in this sort of rounded shoulder forward head type posture. If it's too high, we might be putting too much stress through the shoulder. So again, we're going to have that around that wrist level there. Another thing to keep in mind when we're looking at gait aids is whether it's a step two or a step through gait pattern. So what I mean by a step two is essentially when we're taking our steps, we're going 1 foot and then we're bringing the other to that exact position, versus a step through is your typical kind of gait, normal gait pattern, let's say, where 1 foot is going past, right, the other with a correct heel to toe gait pattern. With our crutches as well, if it's a single leg crutch, you're not going to be putting obviously any weight on the other side. And you can have the same sort of gait pattern there, whether it's a step two or a step through type gait pattern. With the crutches as well, something to keep in mind with that is you're going to actually want to have from your armpit basically to the top part of the crutch, it's going to be about a hand's width. And then again, with where the handles are for the crutch, typically we're looking at around that wrist level as well. So again, important aspect in terms of measurement, important in terms of the proper, whether it's a restriction in terms of weight bearing status that you're going to want to keep in mind with, and then the proper gait pattern, whether it's step two, step through, and again, a lot of that will depend on the specific weight bearing status that you have, whether it's full weight bearing, feather weight bearing, etc. So lots of things to keep in mind. And so I wanted to make a video here just on some general things to keep in mind when looking at gait aids. But again, you're going to want to have a specific measurement done and specific education based on what your weight bearing status is, what your strength level is at. And again, if it's a transition for you from, let's say, non-weight bearing to a walker to then a cane. So you're really going to want to make sure that you're speaking with a physiotherapist to get the correct measurements, the correct gait pattern, and to, again, be able to utilize these gait aids appropriately. The last thing I wanted to mention too, particularly with your cane, which I find a lot of patients struggle with, is you actually want to have your cane on the opposite side of the whatever leg you're trying to offload to some degree. So if I've had, for example, a total knee or a total hip on the right side. The cane that you might be using is going to be on that left side there. So just something to keep in mind. A lot of patients I see actually put the cane on the same side when in fact you want to have it on the opposite side there. If you have any questions or concerns, feel free to leave a comment below. And please check with a physiotherapist to make sure that this or any other information is appropriate for you. And if you're somebody who is struggling, again, with some functional activities and you're looking for some physiotherapy treatment in the comfort of your own home, feel free to reach out. I have my contact information below. Thanks again for watching and have a great day. Take care.